The oldest adage of medicine is that our job is to cure rarely, relieve suffering often, and comfort always. As medicine got scientific, we changed our job description to be that our job is to cure always, relieve suffering if you have the time, and let someone else do the comforting. And I think that was a mistake. We need people to help us live well with illness. There's something about social support, about stress management, that has an effect on disease prognosis, in addition to quality of life when you have the disease. What we're studying is what are those factors, how can we understand them, what are the physiological mechanisms that mediate the effect of stress and support, particularly on cancer, and what interventions can we develop that will help people live better with these illnesses and potentially live longer as well. I started out in college as a philosophy major, and I was reading existential philosophy. And I thought it was wonderful to just think about the fundamental questions in life and how do we understand and manage our brief time in existence, and to what extent does facing those limitations of existence actually help you live more authentically, more fully. I went to medical school, and I found that among the times when I could make a difference was when I walked into a room with an asthma patient who was unable to breathe. And I had just taken a hypnosis class at Mass General. And I said, "You want to learn a breathing exercise?" And she nodded. And so I got her hypnotized. Within 5 minutes, she's lying back in bed. Wheezing is audibly better. And I figured that anything that could help a patient that much had to be worth looking into. So I kept finding examples where if you could just help patients control their pain, control their anxiety, manage some of these symptoms better, you can make a big difference. But there are still a lot of people in science and medicine who are skeptical. So what we're doing is converting this sort of good idea that there are better ways to manage stress into understanding something about psychiatric and also psychophysiological variables that are related to outcome with cancer. And there are a couple of current projects that we have ongoing. One, we've recruited high and low hypnotizable subjects, and we've got them in the fMRI scanner, in and out of hypnosis. So we're excited about using this cutting-edge neuroimaging technology to have a novel understanding of what's happening in the brain when people undergo hypnosis. With integrative medicine, with hypnosis, with effects of group therapy on survival, what I try to do is connect areas that have been viewed as sort of not researchable or speculative to science that gives you a yes or no answer to the question. I feel very fortunate. I've been able to do what interests me, to study the questions that fascinate me, to work with the patients who have given very generously of their time, who want, even to the very end of their lives, to help other people who are coping with the same illness. With them, we are kind of clarifying what really matters to people who are very seriously ill and how to help them deal with it. And that's a very satisfying thing to do.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.